Here's the website I found. It's known as the Frontline COVID-19 Critical Care Alliance. The document itself is the Math Plus Hospital Treatment Protocol for COVID-19. As you can look and see, there's a nice disclosure here about when it should take place. As soon as the patient meets criteria for oxygen supplementation. Also, it notes that the need for mechanical ventilators and ICU beds will decrease dramatically. The only time this treatment seems to not work is when people wait till it's too late and they're already having such breathing problems they cannot be cured. And in this situation, for patients checking into the hospital, almost everybody gets cured when they immediately go on this little known treatment. They are working hard to get this out there to every hospital and every doctor, but for various reasons, as we discussed earlier, many doctors will not give you this treatment. It starts with the methylprednisolone. That's an anti-inflammatory that seems to work really well in this process, and you can see all the recommended doses there. Ascorbic acid, which is commonly known as vitamin C. No surprise there. We all know vitamin C definitely prevents viruses and also gets rid of viruses. Integral part of your immunizational system. Your immune system constantly needs vitamin C. If you're a smoker like me, your body is continually depleted from vitamin C because smoking causes vitamin C depletion. So, by all means, if you smoke, you better take vitamin C. Ascorbic acid, it's recommending 3 grams every 6 hours intravenously. That dose is considered small compared to what a lot of doctors recommend. The recommended daily allowance from the government says you only need about 100 milligrams, about 1/10 of a gram a day. That's based on what you need to not get scurvy. So the recommended daily allowance is kind of a joke. If you get that much, you won't get scurvy, but it doesn't even begin to cover what your body actually needs to keep a healthy immune system. But the total there is 12 grams a day. And, personally, I've seen a lot of doctors doing, 20, 30, even 50 grams a day intravenously to treat many different illnesses. And there's been a lot of success with the intravenous vitamin C. I question if you would need the anti-inflammatory if you reacted early to the COVID-19 and actually did a larger dose of ascorbic acid. Something in the nature of 25 to 50 grams intravenously may actually wipe out the virus single-handedly. The other recommendations here, number 3, would be thiamine, 200 milligram IV every 12 hours until the patient's discharged. On the vitamin C, it also says continue that 12 grams a day for a total of 7 days or until discharged. They sound pretty confident you're going to get discharged. Number 4, and again, thiamine is just another item you can buy right off your nutrition shelf, just like vitamin C. Heparin, full dose, low molecular weight. They're recommending 60 milligrams a day, and up to a milligram a day, or it says 1 milligram per kilogram. Not sure. I guess that's 500 units every 12 hours. Again, that just says continue until you're discharged. The last item is important. It says plus optional co-interventions, but some of these are major factors in how well vitamin C can perform in your body. They recommend you take zinc, vitamin D, famotidine, magnesium, and melatonin. Again, these are items you can find on your nutrition shelf. You don't need a doctor to get going with this vitamin C and all these other nutrients in step 5, including the thiamine, vitamin C, zinc, vitamin D, magnesium, melatonin. All of you could be taking those now just for general good health. And later you'll see there have been some good findings that this vitamin C can certainly act as a prophylactic and prevent you from getting COVID-19. I myself have taken 8 to 10 grams per day of vitamin C for the last 2.5 years. I've not gotten any colds, and I've been very impressed because I, like most people, have typically gotten 2 to 3 colds or viruses per year, and I've kind of done away with that, and I'm very happy about that. The 2-page document here, which is the complete recommendation to all hospitals. It ends with some more information about treatment of low oxygen. And again, they're looking at starting this treatment once somebody's already having a low oxygen problem and requiring supplemental oxygen to breathe properly. So this is definitely being used once people have already suffered the repercussions of COVID-19, having breathing difficulties. You can read for yourself here. If the patient has low oxygen saturation on nasal cannula, initiate heated flow, high flow nasal cannula. Do not hesitate to increase flow limits as needed. Avoid early intubation that is based solely on oxygen requirements. Allow permissive hypoxemia as tolerated. And we'll go down here too and just see this last final statement here, which obviously you should be able to pause and read the entire statement if you choose to. Just to draw attention at the end here, in order to achieve maximal efficacy, that's a strange word, as delayed therapy has led to complications such as the need for mechanical ventilation. If administered early, this formula of FDA approved, safe, inexpensive, and readily available drugs can eliminate the need for ICU beds and mechanical ventilators and return patients to health. Now, of course, we can't say the patient is cured. They may well have recovered from COVID-19, but it would be completely illegal to imply that a vitamin had cured a patient. And, that goes back many, many years where the pharmaceutical companies fought in big legal battles to be able to control vitamins. And luckily, a lot of really good people and nutritional experts fought the pharmacies in court and won. If it were up to the pharmaceutical companies, they would be the only ones producing vitamins, and doctors would be having to prescribe it, and you would not be able to walk down to the Walmart and pick up all these items. But as it stands, thank goodness to the pharmaceutical companies losing that battle. Thank goodness you can walk down to the store and get your vitamin C and thiamine and zinc, vitamin D, magnesium, and melatonin. You can be taking all that stuff later on today if you chose. And quite frankly, the odds of you getting COVID-19 if you're taking this regimen, very slim. And again, vitamin C, it says intravenous, but that does not mean you have to be intravenous. In fact, latest technology has come out with something called liposomal vitamin C, which is actually considered better than intravenous. And this liposomal also it gives you an enhanced dose. I get 2.1 grams per dose when I take this product here. And at 2.1 grams per pill, I only have to take 5 pills a day. Previously, I would have to take 8 to 10 1 gram pills. And thanks to this new product with liposomol, I only have to take 5 pills a day, and that gives me 10.5 grams of vitamin C in my system. More than enough to compensate for my smoking, and hopefully enough to maintain an overall very healthy immune system. But all these other vitamins mentioned are equally as important. Now let's move on from this page, which I hope you all download it and print it and keep it. It's at the website COVID19criticalcare.com. That's where you'll find this information. COVID19criticalcare.com. And also, if you bump over to that website, which we're looking at now, oh, maybe we're not.